Welcome back, patients. This is Dr. Chad Rolland from Edinburgh, Pennsylvania, and I'm just sharing another video with you talking about natural healing and chiropractic. Now, from a chiropractic point of view or philosophy, health is not merely the absence of disease, but actually the normal state of well-being, the way our body was designed to be. In other words, disease is the absence of health. We want to focus on health and promote that rather than say, oh, I have this disease, how can I get rid of that? The two different philosophies or two different approaches in healthcare in our country. Healing and health, of course, depends on four things. First of all, it depends on the life force. If I need to have that life and that energy and that force in order to be able to move forward with healing. Number two, it depends on innate intelligence to direct things, or an intelligent design that put the information in our body as to how it's supposed to work and what it's supposed to do. Number three, there's limitations due to state of energy, nutrition, and the environment that the being is in. And how do we improve each of those conditions? And number four, to heal or stay healthy, we need time. So we need to put all those together in a holistic package in order to create a sense of well-being and a sense of health. Chiropractors typically go to graduate school for 10 semesters, including their clinical training. Fundamental courses are very similar. Some people don't realize that, to medical doctors as far as anatomy, physiology, biochemistry, etc., etc. When medical students diverge and they'll go into surgery and more in-depth in pharmacology, and then of course seeing patients in rounds, chiropractic students focus on imaging, x-rays, MRIs, adjusting, of course, a lot of adjusting and manual therapy, rehab therapy, and then quite a bit with nutrition and herbal therapy. While most think of chiropractic for pain relief, the real power of an adjustment is its ability to remove restrictions and influence the central nervous system. As it helps to create balance and healthy nerve function, patients also experience stress relief, better digestion. For example, I had an older patient and she would come in, and after a while she said, Dr. Rolland, each time when I come in and get adjusted, I find that I don't have to take my Tums after dinner. And as long as she was coming in twice a week, that was fine. And that continued. But when she started coming in and was improving and didn't need to come in so often, or so we thought, and she was coming in less than once a week, now she came in, she said, you know what, my nerves get pinched again and I have to come back and use my Tums because I'm having indigestion again after every meal or after a dinner. So we talked about that, and you could look. Now she wasn't able to continue to come in once a week ongoing, but it was a very interesting and black and white observation by a patient who said, I can see how the adjustments help me, and I can see when I'm not getting adjusted how my nerves are not working as well. Patients also experience stress relief. There's better breathing. We have patients that say they have less asthma symptoms or fewer allergies, and even improved blood oxygen levels. I had a young woman recently who has a lot of medical problems, and she tests her blood oxygen level every night as she's sleeping because it's an important part of her regimen. And she said when she was getting adjusted, for 2 or 3 days, she noticed her blood oxygen levels were higher, and then they would subside and go back down. So there's very intricate or in-depth things that our body is improving as we improve nervous function. There's a book that I like to refer to. It's kind of fun to read. Most of you probably know the Chicken Soup series, but Chicken Soup for the Chiropractic Soul. And this has all kinds of anecdotal stories in it. They're not scientific studies, but anecdotal stories about so many different benefits that patients and their children have received from getting adjusted. I'm also going to talk a little bit about chiropractic adjustments and massage and how they optimize the nervous system, the respiratory system, and the immune system, by helping to not only reduce stress, of course having less stress on our body. We know that stress suppresses the immune system as cortisol is released and there's not as much circulation and there's a few other hormone changes. But optimizing the nervous system interacts with our body in many different ways. This nerve chart over here on the wall, if I look at this, you'll see the nerves that come out of the central nervous system, out of the brain down through the spinal cord, go to, if you're able to see that, every part of the body. The lungs, the heart, the digestion, the kidney system, the liver, okay, the immune system, the digestive system, and the reproductive system. Every part of the body is innervated. And as the interference here affects the nervous system, if it's removed and released by a chiropractor, then those nerves can work better. Can I tell the patient this is how it's going to work exactly? No, we can study it, we can dissect it, we can look at it, but it's a very complex process. And by getting adjusted wherever the patient needs that improvement, then their body knows what to do. It has that innate intelligence, it has that information, and it can go from there and do the healing that it needs to do. Beyond anecdotal evidence, we know that restoring function helps to optimize the nervous system, which I just mentioned, and is closely interconnected with the immune system. The study of psychoneuroimmunology is an emerging field, as is neuroimmunomodulation. In other words, how can I modulate or improve my immune system by helping the nervous system? How can I also improve my mental state, my mental health, by improving my nervous system? How is immunology integrated into that? I was listening to a doctor who's a neurologist, and he said, I would never have thought 20 years ago, 30 years ago when I was in medical school, that I'd be telling patients, you have to take care of your gut and what's down in your digestion, in your intestinal tract, because that is closely related to your brain and how you're going to think and how your mental health is going to be. The nervous system is throughout the entire body, helping it to be regulated and controlled. Some research also specifically suggests spinal adjustments influence the immune modulation, including T and B lymphocytes, natural killer cells, antibody levels, phagocytic activity, which are the white blood cells that eat up the other microbes in the bad cells, and plasma endorphin levels. I'm going to include on my website a couple references for research articles that are coming out, not recent ones, but that have been out showing improvement and changes to the immune system by getting a chiropractic adjustment and how it optimizes the nervous system. I'm also going to show you a great book that I've enjoyed reading called Spontaneous Healing by Dr. Andrew Weil. Many of you may recognize him from public television and the other work that he does. This particular book goes through and will say, oh, we called that, well, I guess you just got better. It was spontaneous healing. Well, how about the patient went in and they started eating better? Or how about the patient started exercising and the patient started relaxing and reducing stress, sleeping better? They were socializing with their family or their friends, or they were getting adjustments, or they were getting chiropractic, or they were getting acupuncture, they were using essential oils, or maybe a whole combination of those. And while medicine or the medical doctor might say, I don't know exactly how you got better, we'll call it spontaneous healing, I guess it just happened. Your body wants to spontaneous heal. And that, of course, is the ideal way for us to get better. That's something that if we can put the right ingredients into our body, nutrition, help remove interferences, do our exercises, make sure we're getting enough sleep, and put all that together, we can get great results and have a lot of improvement in our health. Finally, healthy living, chiropractic adjustments, massage, and a few vitamins. Doesn't that sound like a good natural health care plan? We'll tell you more later. Thank you.